Yeah, so we've seen in the past years many different studies looking at circulating tumor DNA in Hodgkin lymphoma, both to understand the genotype of a specific Hodgkin lymphoma case, so before we start treatment, but also to use these markers we identify as MRD markers, minimal residual disease markers, that we can then use to assess response. So I think we have now seen a lot of basic data that backs up the idea and proves that it works in principle, both to identify the genotype and second to do MRD tracking in Hodgkin lymphoma, and we know it's prognostic. We now need to run these clinical trials and identify the clinical situations where it makes most sense to do this. And I think there's a couple of interesting ideas out there. We can of course look at these subtypes that have been identified, like immune escape Hodgkin lymphoma or gene-driven Hodgkin lymphoma or virally driven Hodgkin lymphoma, and try to adapt treatment protocols to treat these subgroups specifically, or we can escalate or de-escalate treatment based on the MRD response. But how to do that exactly, I think, is a matter of current debate.